We are a group of fourth-year pharmacy students, and this is our proposal for a falls prevention programme in Dartford named FRAMO. The current picture. Falls can be fatal, and they are the primary cause of hip fractures in the United Kingdom, with over 30% of the over 65 suffering from a fall at least once a year. The mortality rates are alarming, with 10% of those with a hip fracture dying within 1 month of their fall, and a further 33% dying within 12 months. So why are we focusing on Dartford? In Dartford alone, hip fractures in the over 65s are 20% more common than in any other part of the United Kingdom. And given that 15% of the Dartford community is aged over 65, it is clear that this is a growing problem that will need addressing. How much do falls actually cost? Well, falls and fractures bring with it an estimated annual cost of £4.4 billion, and in the United Kingdom alone, 2.6 million people have had to take time off work because of a fracture. But it's not just the financial burden of falls. It can also bring with it loss of independence, reduced quality of life, emotional strain on the patients and their families during recovery, and the costs associated with follow-up care and treatments. So what is our solution? Community pharmacies are one of the most visited and dependable services in the UK. With over 11,000 community pharmacies, they are an ideal setting to implement an accessible service. Community pharmacies are accessible to everyone, and pharmacists are already fully trained in providing essential and locally commissioned services. Our aim is to reduce the number of falls in the UK in the over 65s through utilising a range of evidence-based interventions, with the service being broken down into 4 simple steps. Step 1. Identifying eligible patients. Pharmacists and the associated pharmacy staff will be trained to recognise patients who would benefit most from the service. These may include patients with a history of falls, or those on specific medicines which mean that they are at risk of falls, such as benzodiazepines, or patients who have a fear of falling, or patients suffering from conditions that increase their likelihood of a fall, such as epilepsy or Parkinson's disease. Pharmacies will also work in collaboration with GPs, care homes and carers, family and patients who may wish to self-refer. Step 2. The initial consultation. Patients who are identified as eligible for the service will be invited to a private consultation with the pharmacist in order to check their eligibility for the service and establish whether it's right for them. Step 3. Screening and evidence-based tools. Following the consultation, screening will take place using validated tools known as FRAX and the Drug Burden Index Calculator in order to assess how likely a drug is to be causing a fall. Step 4. Adapting the intervention. The intervention would involve working with a range of healthcare providers in order to ensure that the treatment the patient is receiving is right for them. The pharmacist would liaise with GPs in order to suggest appropriate deprescribing of at-risk medicines and to reduce polypharmacy. Patient group directives will be set up for the supply of vitamin D and calcium supplements. Physiotherapy partnerships will be established to allow patients to be referred to improve movement and flexibility. And non-pharmacological advice will be offered, including exercise referrals and appropriate footwear. So what will this service bring to Dartford? The service will provide a greater sense of freedom for its service users. It will reduce GP time and hospital admissions and their associated costs, and ultimately encourage the NICE QOF targets to be met. So how do we plan on delivering the service? Well, pharmacists are already clinically competent in the provision of essential services and medication reviews, meaning that the training is relatively limited. Pharmacists and pharmacy technicians will be signposted to an online falls prevention workshop and be required to complete an e-assessment. The pharmacists will also be invited to 2 online seminars in order to bring together their learning. And finally, pharmacists will provide a 1-hour training session for associated pharmacy staff using a presentation which will be provided by us. So how will we support pharmacies delivering the service? We will provide a 6-month follow-up period. We will also include annual reviews and consultations with patient advisory groups. We will obtain feedback from our stakeholders and hold focus groups for patients and medical professionals. And finally, we will also investigate errors and complaints, performing a root cause analysis in order to learn from errors. Preventing falls is our first priority, and Framo is a service that can help achieve this in Dartford. It's accessible from local pharmacies and will improve patient quality of life and reduce the NHS and societal costs.